So let's go over the femur now. First of all, I just want to point out that so up here, the head of the femur, see this little dot right here? This is a good picture that shows it. This little dot is the fovea capitis. And if you remember, it has the word cap in it because it's on the head of the femur. Then that'll help you remember the name. And the femur right here, the head of the femur, this whole section right here, fits into the acetabulum of the pelvis. This femur head right here fits into the acetabulum of the pelvis. Like here's where the acetabulum of the pelvis would be, that circle in the sides of each side of the ischium, ilium, and pubis bone. So the femur fits into the acetabulum right here with the ball and socket, joint. This whole thing is going to be the shaft. You're going to refer to this this whole section right here as the shaft of the femur. Do you notice how up on the head of the femur it looks white? Because it's very smooth and there's probably cartilage there in the ball and joint socket. And it's very smooth and it's colored differently. So also I want to point out to you down here, you can notice the same thing around the knee. See, this is white, and here is the posterior. This is the posterior. And down here, this is white. This is the part that fits over your tibia and your fibula to make your knee joint. So these smooth white surfaces, not necessarily white, but just smooth and light, are all condyles. And I think I've pointed this out in some other skeleton videos. But the condyles are just smooth, flat sections of a bone that connects to another bone. That's the place on the bone that's going to connect with another bone. There's going to be another bone right there next to it, or continuing in the limb in this case. So pretty much anytime you see bones connected to other bones, there's going to be condyles involved, because you want it's a smooth surfaces on those sides of the bones when they come together, because you don't want rough areas to be grinding against each other. So these are called condyles down here. And also the prefix epi means above. So down here on the in the femur, there are called epicondyles. So where would epicondyles be? They would be these bumps right above the condyles. So these would be bumps right above the condyles, epicondyles. So anytime you hear the word epicondyle, you know it's just going to be a bump in a bone right above a condyle. Anytime you hear the word condyle, you know it's going to be a part of a bone that connects to another bone. So it's going to be a nice, smooth, flat surface. One other thing I wanted to point out to you on this picture, do you notice how on this, see, this is the anterior, the front, and this is the posterior, the back. This would be the right leg, the right femur, the patient's right. And so do you notice how on the right leg this comes in on the medial side? Like, so here's the median of the body right here. So the left leg is going to be over here. So this would be the center of the body, the center line. Of the body. And so the one in the direction, the side of the femur in the direction of the center line of the body right here, it pokes out a lot more. See, there's a lot more there than how much the other side, the lateral side, pokes out. See, this pokes out much shorter, a much shorter distance than this. And so over here, this is the back of the leg. So this is also the right leg, so you don't get confused. This is just the back of it. So this is, the center line is still going to be this way, and it pokes out much more toward the center line, the median line, or the medial line, than the outside, than the lateral side. Okay, so this is lateral, and this is medial. And that's how you're going to know if this femur is right or left. And you can also tell by the way, the direction the head is facing up here. But for all of the limb bones, like the humerus, also in your arm, in your upper arm, it's going to poke out where the elbow, where it stops right before the elbow, it's going to poke out medially. So that's how you can tell which side is which, if this is the inside or the outside of the bone. Okay, now let's look at this bone. I just wanted to change pictures so you get in the habit of being able to look at different bones and being able to identify them, even if you're looking at a different bone than you're used to looking at. So here's a different picture of the femur. This is the anterior view. This is the posterior view. So which leg would this be? Would this be the right or the left leg? This would be the right leg. And this is the front, and this is the back. So of course here's the head of the femur, and that goes into the acetabulum of the pelvis. On top is this little dot, and that's called the fovea capitis. Now here is what you call the trochanters. Here's the greater trochanter, and it's this whole bump that bumps up and all of this rough stuff in there. And here's the lesser trochanter. So greater, lesser, trochanter. And the trochanter, just like the tubercles and the tuberosities, this is another T word, and this also is an attachment for muscles. So pretty much all the T words, I think except for the word transverse, that means, transverse means horizontally, going back and forth, left and right. The trochanters are also a place for the muscles to attach to the bones. But the difference is that the tubercles are just a rough patch, and the tuberosities are just a rough patch on the bone, on the surface of the bone. And a tubercle is like a rough bump on the surface of the bone. The trochanters look like a pulley. They almost work like a pulley. It looks kind of like a pulley, and it's shaped kind of odd, and that's why they call them trochanters instead of just calling them tubercles as well. It's just a different shape. So here would be, on the back side, here would be the greater trochanter, and here would be the lesser trochanter. And on the front side, if you see this line between this indentation, between the two trochanters, the greater and lesser trochanter, and let's look over here, just this line on the back side, this line that goes between the greater and lesser trochanters, that's called the Intertrochanteric line. Just a line, that's all. Inter means between. Now not E-N-T-R, but I-N-T-E-R, it means between. And you just have trochanteric is just the adverb form of trochanter. So there's the greater trochanter, the lesser trochanter, and the line in between them. Now the neck of the femur is right up here, right around here, when you get to underneath the head. Like here's the head, and so the neck would obviously be this section under the head. So that's kind of obvious. But let's look on the back of the femur for a minute. If you look on the back of the femur, you see this indentation right here. Do you see it? and it goes down, and it's this rough patch, and there's this line that goes down all the way down the shaft. Do you see this line? And it gets rougher up here. You notice how it gets rougher up here in this section? Well, so up here at the greater trochanter and lesser trochanter where they meet, there's this rough patch right up here, and this is called the gluteal tuberosity. Gluteal because the gluteal muscles attach there, and tuberosity again is just a rough surface on the bone where muscles attach. And so the gluteal muscles, your butt muscles, attach from the pelvis. The pelvis is in the middle here, and they go down and attach here at the gluteal tuberosity. And you can see more about that in my muscles video. And then beyond the gluteal tuberosity, the line extends and it goes all the way down this line right here. This is called the Linea Aspera. And I don't know, I guess linea is some sort of foreign language for line. I'm not sure what this means, but it's a line. Linea Aspera, and that's where some muscles are attached. That's why you need to know this. Now in the back view, while we're still on the back of the femur, down here where the knee would be, on the very, very bottom, this indents in. And there's this little surface right here, right where you bend your knee back. The bones stop right. The bones all stop right there. It's like a doorstop almost, but it's an indentation into the knee, or into the back of the femur, right above the knee, and that's called the popliteal surface. And remember, popliteal is just the medical word for the back of your knee, and that word will come up a lot because there's a popliteal muscle, there's a popliteal artery, there's popliteal, a lot of stuff just right around the back of your knee. In the front here, see, there's also the indentation continues all the way around, and it comes up here, and your patella would be down here. This would be your patella, your kneecap. And so this right here is just the patellar surface. Because the patella goes in the front underneath the femur. So the patella goes in the front underneath the femur. So that's why the little indentation underneath the on the bottom of the femur is called the patellar surface. On the back, it's the popliteal surface, and it comes up more. Now, as I was talking about condyles before, this is the back of the knee over here, and there's this big, this is actually round. This, you're looking at, it's almost round, like here's the side picture of the femur. The bone comes down, and there's this rounds off like this. And so what you're looking at, if you were looking at this bone from an angle, you would be looking at this back surface of this round section right here. So these two are round, and they go all the way underneath. They go underneath, and then they come up this way. This smooth surface like this. And so what is a smooth surface? And look at where this is in the femur. This is the bottom of the femur. So this is going to connect you to the knee joint and to the rest of the leg, to the other bones, to the tibia and the fibula. These would be condyles right here, because it connects, it's the smooth surface of the bottom of the femur that connects to the tibia and the fibula. Now, of course, this is the medial side of the leg, of the femur. So this would be called the medial condyle. This is the lateral side, and it's called the lateral condyle. Oops, so that goes all the way down to the condyle there. So these smooth surfaces are called condyles, medial, lateral. And notice that the medial side sticks out way more than the lateral does. And see on the back, on the posterior view, the medial sticks out way more than the back does. Up above the condyles, the medial and the lateral condyles are little bumps right here. Right above, and you can see them kind of on this side too, because they go over on the side of the bone. These little bumps right above the condyles that go over on the sides. They're right above the condyles, so what are they called? That's right, epicondyles. Epi means above, so above the condyle. So this would be the medial epicondyle, and this would be the lateral epicondyle, above the condyle. And finally, one more thing. There is this rough surface right here on the medial side of the femur above the epicondyle, and it's like the little bump that's right here. And there's it's a rough side right here too. And there's this little bump that comes up right above the medial epicondyle. And this is just on the medial side of the bone. This is called the adductor tubercle. Now remember, I said most T words, except for transverse, but like tubercle, tuberosity, anything with tube in it, and also the trochanter, those are all places for muscles to attach. And a tubercle is just like a bump where a muscle attaches, pretty much. It's like a rough bump. It has roughness to it, and it has a bump, and that's where a muscle attaches to it. So the adductor tubercle is named that because the adductor muscles attach to it, and we'll get more into that when we get into the muscles of the pelvis and the feet and the leg. But the adductor muscles are pretty much the muscles on the inside of the leg. Because they pull inward. So here's the 3D version of the femur, so we can move it back and forth so you can see. So here's the front of the femur, so you can see it attached to the pelvis right here. And up here, here's the femur head, that little green piece, and you see it's fitting into the acetabulum right there. See the acetabulum of the hip bone? And here's the neck of the femur, and here's the greater trochanter. See this part, the greater trochanter? Here's the lesser trochanter, and here's the line between them. Remember, what's that line between the trochanters called? Between is inter, so intertrochanteric line. And then down here, you want to see the adductor tubercle. That's this little tiny bump above the epicondyles right there on the femur. Just this little tiny bump. You can see it better when we get to the back, I think. And then here is the medial condyle. Here's the condyle, because see, here's the tibia right down here. And so there has to be condyles between two bones, and those are just smooth surfaces of the bones so they can fit together. So this is the femur's medial condyle. If you go up just a little bit on the side, it's the medial epicondyle because that's above the condyle. So if we move this over and you look on the medial line, see medial epicondyle, and here's the adductor tubercle. Medial epicondyle, condyle is down here where it touches the tibia. Let's keep going around and see where this green section is right there. That's the adductor tubercle. And then here's the medial epicondyle is on the edge right there. And you notice how the medial section sticks out way further into the medial line than the lateral section sticks out at the bottom of the femur. Now let's turn this around and see the back of it. And there's all sorts of good stuff on the back. Here is, down at the knee, here is the rest of the condyle. Remember I showed you it goes up in like a wheel shaped, and we're looking at the edge of the wheel, and that fits on top of the tibia down here. See, here's the tibial medial condyle and the tibia's lateral condyle. So the femur, the lateral condyle, goes next to the lateral condyle of the tibia, and the medial condyle of the femur goes on top of the medial condyle of the tibia. In between the two femur condyles is the intercondylar fossa. Remember, inter just means between, so intercondylar just means between the condyles, and a fossa is just a little depression there. So that just means this little ridge or depression in between the condyles, intercondylar fossa. And then right up here in the popliteal surface, the popliteal area is just this little triangle right here, which is just above the back of the knee. So that triangle is the popliteal surface. This whole thing is the shaft. I don't think you need to know the medial supracondylar line or the lateral supracondylar line. Let's go up to the top of the femur, and you can see the head. If I turn it this way, you can see where the head fits in. See, there we go. It's green now. See where the head fits into the pelvis, like a ball and socket joint. And then right underneath the head is the neck. And then this big bump right up here is the greater trochanter. It's greater because it's higher than the other one. This is lower, so this is a little lesser. And this is the Intertrochanteric Crest or line. It's the same thing. It goes all the way around. It goes all the way around the in between the two trochanters in the front and the back. In the back it's called the crest, but it's the same thing. It's intertrochanteric, which means between the two trochanters. And then down here there's this rough patch called the Gluteal Tuberosity. And the Gluteal tuberosity is just a rough patch where muscles attach. So that's named the Gluteal Tuberosity because the gluteal muscles from up here on the crest of the ilium up here on the pelvis come all the way down, and they attach to the trochanters and they attach to the Gluteal Tuberosity. So the gluteal muscles attach to the Gluteal Tuberosity. That's why they named it that. And then below the Gluteal Tuberosity, the line keeps going, and that line is the Linea Aspera. And I always think asparagus for some reason. That just reminds me of aspera, so that's how I remember it.